It has been the topic of conversations and protests for the past year. Reform the police, defund the police, abolish the police. Well, now the city of Pittsburgh is seeing a new movement to help the police. Good evening. The motivation is to lift some of the burden of public safety from the shoulders of police officers.
KDKA investigator Sheehan has been looking at just what this would entail. He joins us live with a story new at 6. Andy.
Well, Kim, the city is in the process of creating a new Bureau of Social Workers to assist police in dealing with the homeless and others. But already a new program has hit the streets and is leading the way. They're the homeless, the addicted, and the mentally ill. And oftentimes they end up on the wrong side of the law, creating safety concerns for themselves and others. When police are called in, the options are few, primarily arrests and jail.
We want to be in a position to respond to situations that they may encounter, that they may feel, ill-equipped to deal with or handle adequately.
Enter crews from the newly created Homelessness and Urban Poverty Medicine program at the Allegheny Health Network. Mobile teams of outreach workers trained to help this vulnerable population. So far, police have gladly used their services.
Asking us for help around, we got this guy in this situation, we've been called 5 times. Is there something better that we can do for him? We've taken him to Western Psych.
As certified EMTs, they provide street medicine to take care of basic medical needs, but also counseling and providing new options like emergency shelter, supportive housing, and an array of social services.
We just made some coffee. Do you want some?
Police have begun calling them to intercede, but the crews aren't waiting to be summoned, building relationships with street persons like this man, providing options other than the criminal justice system.
People don't need to go to jail to get housing because the jail's not going to help with that piece of your life. People don't need to go to the hospital because maybe they had a little bit too much to drink. We can bring our medical staff out to make sure you're safe and stay with you to sober up a little bit.
We don't take this lightly.
And the city of Pittsburgh is watching closely as it creates its own outreach agency, the Office of Community Health and Safety. Director Laura Dragowski is coordinating development with police, fire, and EMS, mindful of not stepping on toes and doing it right.
And we also know that as we scale, we need to build trust, we need to have safety protocols, we need to make sure communication is excellent.
Now, that Office of Health and Safety is now hiring and training people, but it is still a work in progress, trying to figure out the best way to help police and other first responders address the needs of this vulnerable population. Reporting live on the North Shore, Sheehan, KDKA News.